So we are going to discuss this topic today: chemistry, sources of vitamin D, synthesis, recommended daily allowances, biochemical function, and deficiency manifestation. I can guarantee you can have one or two questions in your exam from this class, from clinical cases. Just like vitamin A, vitamin D also very important. Another vitamin K, I will discuss later on. They are also very important. Okay. Let's start. There are two sources of vitamin D. One is plant source, another is animal source. Plant source are argocalciferol, also called vitamin D2, and cholecalciferol, vitamin D3. There is an animal source. Vitamin D, also called as sunshine vitamin. Its synthesis starts from skin. Epidermis on skin. Okay. When exposure to sunlight, that is ultraviolet B radiation. What is UVB? 280 to 350 nanometer. That is B. UVB. What is ultraviolet B? That is 380 to 280 to 350 nanometer. In this range, there is called UVB radiation. What is UVA? 350 to 400 nanometer. That is UVA. You don't have to remember. So in epidermis, 7-dehydrocholecalciferol in presence of UV radiation is formed cholecalciferol. That is called provitamin D. Then it releases in the blood. Via blood it reaches in the liver. In the liver there is one enzyme is there. That is called 25-hydroxylase. This enzyme converts provitamin into cholecalciferol in presence of NADPH, cytochrome 450 and molecular oxygen. 24 and converted into 25-hydroxycholecalciferol. That is the major circulatory as well as storage for vitamin D in our body. You have to remember this one. Okay. Then in kidney, another enzyme is there. That is called 1-alpha hydroxylase. It converts into 125 dihydroxy cholecalciferol. They are also called as calcitriol. So precursor is 7-dehydrocholesterol is formed in the skin and released in the circulation. From there it reaches in the liver. In liver, with presence of 25-hydroxylase enzyme, it converts into cholecalciferol with presence of NADPH, cytochrome 450 and molecular oxygen, and forms 25-hydroxy cholecalciferol. That is a major storage and circulatory form of vitamin D. And when reaches in the kidney with presence of enzyme 1-alpha hydroxylase, it converts into calcitriol, 125-dihydroxy cholecalciferol. This is also called calcitriol. Okay. This is synthesis of vitamin D. Any question? This is a very simple diagram. You must have to go to the textbook I am giving you some gist, one brief explanation. Okay, next, look at this. There is in the skin, as I have already told, in the skin with presence of UVB radiation, cholesterol, 7-dihydrocholesterol convert into cholecalciferol, and then it bind with vitamin D binding protein DVBP. Can you see from last bench? VDBP, vitamin D binding protein. It bind, this is a protein, and then it reaches in the liver. Okay, this is the transport protein, vitamin D binding protein. Okay, and then in liver, one enzyme is there is called 25-hydroxylase. Okay, with the presence of molecular oxygen in cytochrome P450 system. This convert into what? 25-hydroxy cholecalciferol. And then this is the most in the storage and saturated form, vitamin D. Convert into 125-hydroxy vitamin D3, active form. And then this active vitamin, it go into its target tissue and bind with the receptor, vitamin D receptor plus RXB receptor. There is total receptor. They bind with receptor, and receptor is present inside the cell, remember. Okay, this is the reason vitamin D act like steroid like hormone, remember. So in your exam we may ask you one question, justify 2 or 5 marks, please write down. Justify vitamin D is a hormone. Why? First reason is synthesized somewhere else in the skin, and then you have to activate by some process. First of all liver and then kidney, and then go into the target site. You bind with receptor, intracellular receptor. Once in bind with intracellular receptor, it activates some gene present in DNA. Once gene is activated, it produces RNA, messenger RNA, and then it produces protein, active protein. You understand? বুঝলেন? বুঝতে পারেনি? বলবে তো না বুঝতে পারলে। Why vitamin D is a hormone? So anyone tell me what is the characteristics of a hormone? তুমি বলো, বলো। Hormones are substances which are produced by some group of cells in a particular area. Then it reaches its target site by circulation or somewhere else, and then it starts reaction. Just a vitamin D also, it produces in skin and reaches in target site. Understand? Please sit down. What is the target sites? Primarily 3 target sites is there. First one is intestine. Next one is bone, kidney. Very good. These are primary target sites. Apart from this, vitamin D also has some action on T cells, T lymphocytes. This is the reason vitamin D also acts as immunomodulator. Okay. Vitamin D also has some action in insulin function. Vitamin D has multiple actions in our body. It is believed that vitamin D also prevents cancer, some cancer. But unfortunate thing is that in our country, majority of people are suffering from vitamin D deficiency. Majority. More than 95% people are suffering from vitamin D deficiency because actually we are black people. We have a lot of melanin in our skin. We all Indians are actually black. Lot of melanin pigments are there in our skin. So when sunlight hit out in our skin, it cannot absorb properly UVB radiation. Some people living in northern India like Kashmir, Jammu Kashmir, Haryana, they suffer more vitamin D deficiency. Who is smiling? Huh? Who is smiling? Is a joke going on here? Okay, next. Sources. First of all is exposure to sunlight. Next one is food source, especially animal source, fish, meat, egg, egg. Fish like seafood, seafish oil. Next, please shut down this one. Recommended daily allowances. In children, 400 international unit, adult 200 per day actually, per day. Pregnancy lactation 400 international unit and elderly 600 international unit. We may ask in the exam, Viva exam. Okay. Next. Complete na? Next. Biochemical function, very very important. This study is very very important. Most important function of vitamin D is regulate calcium ion level in our blood and phosphate level in our blood. Calcium and phosphate level both. This is the primary function of vitamin D. Next, action as hormone, as I told earlier. Vitamin D has action like hormone. Next, primarily three site of action: intestine, bone, and kidney. Next, behave like steroid hormone because it has intracellular receptor. It has intracellular receptor or nuclear receptor. Okay. Next. Main function is to regulate the calcium level in blood. There are three set of action as mentioned above: intestine, bone and kidney. These are main site. Don't speak, please. Next, an intestine, it attached to the brush border intestinal cell wall, vitamin D, and then it go inside cell and bind with vitamin D responding elements, and then transcription and increase calcium binding protein releases. This calcium binding protein, which in turn increases calcium ion and phosphorus absorption from intestine. Understand? Very easy. One vitamin D bind with intestinal brush border cells, it go inside the cell. Inside the cell, it bind with vitamin D responding element, and then it go and bind with specific site of DNA, where it activates the gene. As a result, transcription occurs, and this transcription causes release of mRNA, messenger RNA. Messenger RNA produces calcium binding protein. There is one protein. This calcium binding protein increases absorption of calcium ion and phosphorus from intestine. This is the site of action in intestine. Complete this one. Very simple, but all of you have to remember this. Again, I am telling you, vitamin D is very, very important. You may ask one or two questions in exam. I guarantee you. This is the must learning topic. Okay. Next, in kidney it bind with renal tubular cells. And increases absorption of calcium and phosphorus from renal tubule. By this way, it inhibits the wastage of calcium ion and phosphorus from our body. In kidney. Next, in bone, vitamin D or calcitriol has action in bone. It causes remodeling of bone. There is formation of new bone. It bind with osteoblast. There is three types of cells in bone: osteoblast, osteoclast, and osteocytes. Osteoblast is immature cell of bone. Osteocytes are mature cell, and osteoclasts actually they are cutter. Remember, they destroy the bone. Causes bone resorption. Osteoclast. Vitamin D bind with osteoblast and causes mineralization of bone. Calcium and phosphorus absorption occurs in bone. So, in vitamin deficient patients, they suffer bone demineralization. Accelerates osteoporosis. What is osteoporosis? जोरे बोलो. Kita? Hollow in, sponginess of bone, right. This is complete, everyone? Next slide. Other function. It regulates the action of parathyroid hormone and calcitonin. Regulates the action of parathyroid and calcitonin in hormone. It regulates T cell, lymphocyte, leukocytes, cell function, so increases immunity. One interesting thing, during COVID time, a lot of research going on vitamin D. So and vitamin D in patient with COVID patient, we regularly use them vitamin D supplement during COVID times. So student here who is suffering regularly with cough and cold, they can use vitamin D supplement and you can experiment yourself. Because vitamin D deficiency is very common, almost all people. Everyone should take vitamin D supplement, at least once in a week, one supplement. Some soft gel capsules available in market, 60,000 strength in capsules. Everyone should take at least once in a week, because every time, every day you are here inside the indoor, you have very least time exposure to sunlight. So almost everyone here, you may suffer vitamin D deficiency. If you go some vitamin D estimation, you may found some vitamin D deficiency in your blood. Okay. It can regulate the action of insulin function. So in diabetes patient, we often prescribe vitamin D supplement almost regularly. Also used in some disease like psoriasis. And what is happening in psoriasis? There is excessive proliferation of cells occurs in skin. So we use vitamin D supplement. It can prevent excessive cell proliferation in psoriasis. Okay, next. These are very important. Deficiency manifestation. In children, deficiency causes disease called rickets. Very, very important. This topic. I am coming later. Rickets. In adult, there is called osteomalacia. Some other forms like renal rickets and vitamin D resistant rickets are there. You have to remember, rickets in children very, very important. Please take screenshot this one. Rickets in children. First manifestation is craniotabes. That is soft and pliable skull bones. Vitamin D function as mineralization of bone formation. So in deficient children, they cannot mineralize their bone properly. As a result, their skull bone becomes soft and pliable. If you press their skull, it feels like a table tennis like ball, soft. Delayed closure of fontanelle. What is fontanelle? Fontanelle? You know fontanelle? You learn in anatomy classes. Fontanelli gap is there. Fontanelli, this one, this here. In children, Fontanelli. As the children grows older, 6 to 7 months or 1 year, all the gaps eventually closed. So vitamin D deficient children, they delayed closure. You will read in anatomy class, no, don't worry. Fontanelli. Frontal bosom, that is, this area become very bulge. This area, this is called frontal boozing. Because inside the head, the brain is there, and the skull bone is very soft. It is pushing the brain up forward. Okay, so it is like this one, a gap, just bulging of frontal bone. Widening of epiphysis in radius ulna. As a result, there is a decreased mineralization. So there is a widening of epiphysis. Next, board leg become this. I am telling you, coming later. These two are very important. Rachiatic rosary and Harrison sulcus. In your MCQ, PG entrance exam, in your later examination, we may ask this kind of question. Rachiatic rosary, Harrison. These two terms should be familiar with everyone. Okay. What is rachiatic rosary? There is prominent beaded appearance at the junction of rib and its cartilage. Like this. Look at this. Okay. This is cranial taps. Just pressing the finger, it is going inside fingers. This is called cranial taps. Harrison sulcus. There is indentation of the chest, roughly and the sixth rib. Look at this. Sixth rib area. Indentation is there. Harrison sulcus. This is board leg. The legs become bow-like. Why this is happen? Because bones are very soft, na? The baby cannot mineralize their bones. Bone become very soft. When the child start walking, their leg becomes this shape. Okay, defect is here. Okay. So this is cranial taps. This is rachiatic rosary, board leg, Harrison sulcus. Okay. In adult, there is called osteomalacia. There is softness of bone. Easy fractures. Have you seen some ladies after 50 or 60 years, when they go to bathroom and slip their foot, as they fall in the ground, they become suffer fracture here, radius bone, Colles fracture. Have you heard? Very common in adult because of vitamin D deficiency. This is one cause actually. Easy fracture. Accelerated osteoporosis. Osteoporosis means sponginess of bone. Bone becomes soft. They lost calcium and minerals. And another thing is that decreased blood level of calcium ion. What is the blood level of calcium ion? Normal blood level 9 to 11 milligram per deciliter. 9 to 11. Nine to 11 milligram per deciliter blood level in calcium. Vitamin D deficient cases, there is decreased level of blood calcium ion. Okay. Look at this picture. Normal blood level of vitamin D. We measure this in 24 hydroxy vitamin D. There is a storage from vitamin D. Normal level is more than 30 nanogram per ml. When there is a decrease less than 30 nanogram, 30, there is called insufficient level. Less than 20 nanogram per ml, there is called deficient states. Less than 10, there is severe deficiency. More than 150, there is toxic level. Who is talking? When I was working in AIMS Patna, that time once I measured my vitamin D level, and very unfortunate thing is I found only 16 nanogram per ml. So you can understand, very common vitamin D deficiency. One PG student is there, she was working in AIMS Patna. She measured her blood vitamin D level, she found only 4. Only 4. Very common vitamin D deficiency. Okay? Any question till now? You should remember this table, this chart. More than 30, just remember more than 30 is normal. More than 150 is toxic level. Although vitamin toxicity is very, very rare. Very, very rare. Less than 20, there is deficient states. Less than 10, there is severe deficiency. Even the patient is suffering from severe deficiency, they may have suffering from some other problem also. Like they have some immune deficiency also. They may have some frequent attack of cough and cold, infection. Okay.